During your periods, you can get soft poo or straight up diarrhea. Or on the flip side, you can get constipation, which is hardening of that stool. Now, period poo is a thing, by the way. Now, I'm going to explain to you why this usually happen and how you can be able to deal with this in case it's troublesome to you. Now, let's start with the running stool. Running. Now, diarrhea, that soft stool. What usually happen? Your uterine wall will be affected by what we call prostaglandins. Now, prostaglandins are usually produced by the uterine lining, and this is to facilitate construction of the uterine wall. This will facilitate in breaking down the wall, and this is how you're going to get your menses. Now, when you overproduce the prostaglandins, some of that will leak into the blood, and this will be taken elsewhere. Remember, prostaglandins usually affect the smooth muscles. Now, one of the smooth muscles, the intestines. Now, when it gets there, the intestines will have to speed up everything. So if you have contents in the intestines, they're going to be hurried up, if that's a thing. So it's going to quicken everything, so everything will be hastened. Now, you're not going to have enough time for the absorption of water from the food material that you have in your intestines. And this is why you're going to get that soft poo, or maybe just straight up diarrhea. If you usually get that diarrhea and it's severe during your menses, what I would advise you to do is before the onset, before your ovulation, just take a non-steroidal anti-inflammatory drugs like something like ibuprofen. That is, if you usually don't have issues with your stomach. Take that, it will inhibit the production of prostaglandins, and this will it will reduce the amount that you're going to have. So this will have less effect, so you're not going to have that overflow of the prostaglandins that will go to the intestines and cause the chaos that we talked about. So you can do that. Now let's go to constipation. This is when you have less production of prostaglandins and also overproduction, or you have more progesterone in your blood. Now, remember, we said that once you become pregnant, you are highly likely going to have constipation because of progesterone. This is exactly the same effects. It usually slows down the bowel movement, meaning the contents of the intestines will have more time. So water absorption will be high, meaning that you're going to make that hard. So it will be harder than normal because it's going slow. So it will take more time in the intestines, and you're going to have more water removed from the content. And that's why we are going to have that hard stool, leading to constipation. Now, we have several things that you can use to mitigate this. One is taking a lot of water. The second one, which is very important, is to make sure that you include both soluble and non-soluble fiber. So foods containing those, very important, and also increase the amount of water that you are taking. And in case this is still troublesome, you can go ahead and use laxatives or poo softeners. We have drugs that will do that. So if you take laxatives, they're going to force everything down all the way out, so you're not going to suffer from constipation. But then it will depend. If you usually get this all the time, it's better to just focus on not medication, focus on the food that you're eating and also water, so that you make it a little bit softer. Or maybe just take little foods and then push that with a lot of water and a lot of fiber.